Infectious diseases such as HIV/AIDS, tuberculosis, and malaria are causing serious health problems and are responsible for over 5 million annual deaths in developing countries. JICA assists the efforts of developing countries to combat infectious diseases by promoting preventive measures, testing and treatment, and through the training of human resources. JICA's cooperation is not limited to donating medical supplies and equipment. It aims to promote health services by helping to build a system that enables the recipient developing country to take the initiative in providing sustainable health care. Let's look at a project in Zambia, Africa. Ikuma Nozaki is a JICA expert who is working on a project to expand HIV/AIDS care services in Zambia. He is heading for a village 150 kilometers west of Lusaka, the capital.
With this project, we've encouraged increased HIV treatment services in health centers. County health departments form teams and go to health centers to provide treatment. I train people and observe.
Once every 2 weeks, a mobile clinic is open for people with HIV. Today happens to be that day. Medical teams from the district hospital are dispatched on a regular basis to the district health centers to supervise the treatment of HIV/AIDS. JICA has been supporting the program, which is helping to extend HIV/AIDS treatment to rural areas with limited medical personnel and resources. Nozaki is talking to a member of staff who has received training on counseling and HIV diagnostic testing. He's neither a nurse nor a doctor. A district in Zambia may cover an area of several thousand square kilometers, but there are only 3 doctors per district. There are no doctors in this village. So the health center is run by so-called clinical officers, medical personnel, nurses, and trained members of staff. That's why the district health office needs to provide the health center with regular guidance.
So even though you finish to enter all the information to the computer, I think it's better to keep the...
Yeah, the records won't stop.
Yeah.
In fact, even as at now, since this register, as you can see.
The health center's patient registry makes it easy to keep track of patients' visits. JICA helped improve the previous registry to prevent incomplete records.
Even though in future, if JICA stops or goes somewhere else to other areas, the services here will still continue because the number of people that now shows itself that it's increasing every month, every week when we are having this at clinic.
The HIV prevalence rate for adults is 14% in Zambia. 1 in 7 adults is HIV positive. The average life expectancy has dropped to under 50. At present, there is no cure for HIV/AIDS, but the treatment can suppress the activity of the virus so that it's possible to prolong the lives of many people with HIV. However, in Zambia, because of the chronic shortage of medical personnel, these medications were unavailable to most patients. In order to control HIV/AIDS, in spite of the shortage of medical staff, and to provide treatment closer to home, hospitals began dispatching medical staff to village health centers. A mobile clinic service was introduced.
A new changement is coming. So otherwise you improve this health center rather than we moving up and down 14 kilometers coming here. It's a long way. Sure.
We are seeing less of chronic cases taking long on the wards. Now we can only see a patient coming in 3 or 4 days, 5 days maximum, they are discharged. So the quality of care has improved.
The land next to the health center is being cleared by volunteers. They're all HIV positive.
We look ourselves that we are HIV positive. Then after that, we come together and make one group. Then we started the programs of being together to cool down ourselves. Because in this area, it was too shameful to come openly. So at last we come openly, the small group.
AIDS medication needs to be taken regularly, every day to be effective. The patients need support from their family and friends, and also from the community. Mobile clinics organized with the help of local volunteers are proving to be very effective in monitoring HIV/AIDS epidemics and expanding the service area of treatment, especially in rural areas with scattered populations. Now that meticulous care is available at nearby health centers, very few people miss out on treatment.
Our target is to actually reach everybody who requires HIV services. So again, it's an indication of a working partnership with JICA, and we hope that with the experiences we've had, now that we are doing a national rollout, we are going to probably gain and speed up the process of rolling out the mobile ART.
JICA's financial contribution to the fight against HIV is only 1% of the total assistance Zambia receives from around the world. But we managed to involve the health department. In the future, I hope the country will have a system that can be managed using the resources Zambians have at hand.
Making use of existing facilities and systems to involve the community and establish a sustainable health service program. This is typical of JICA's cooperation in developing countries. JICA is doing what it does best to support Zambia not just through the donations of funds and equipment, but through capacity development